Now, an anti-Ebola drug being tested in Guinea is showing some encouraging signs in treating the disease. The drug is called favipiravir. The antiviral medicine is showing early signs of effectiveness in its first human test against Ebola. Medical charity Alliance for International Medical Action, ALIMA, conducted the trials in Guinea. Augustin Ogier, the Secretary General of ALIMA, explained the parameters of the drug.
It has no impact on people who are already very sick, with what we call high viral loads, but it has an impact on the mortality for people who are not very sick. And the mortality went from 30% to 15%. So we don't have enough patients to say that it's statistically significant, but it's a very strong message to say that it can be efficient and it can really help to cure the people if they come when they are still not very early in the Ebola treatment center.
The outbreak of Ebola has killed close to 10,000 people across West Africa over the last year. The number of new cases has plummeted, but officials say much work needs to be done before the virus is snuffed out in Liberia, Guinea and Sierra Leone, the three worst affected nations. Ogier says he hopes the drug will help.
We hope that it will reinforce the confidence link between the affected populations and the health centers that are treating Ebola, because people now will have a strong message saying that there is a treatment specific for Ebola and that the mortality is going down in the Ebola treatment center.
The Guinean government has authorized the use of favipiravir in some Ebola centers, but Dr. Machidi Somoeti, who recently took over as the regional director of the WHO, says more research should be done.
The fact is that a trial is currently being conducted on this drug. The results of this trial to enable WHO to recommend that it starts being used. I think it is still in the process of being looked at and considered, and I'm sure as soon as WHO has the information, we will, if it's appropriate, recommend that it be used and considered in the same way as was being done for some of the drugs that were being used on an emergency basis.
Favipiravir was developed by a subsidiary of Japan's Fujifilm to treat the flu. No negative side effects were reported among 80 patients during the Guinea trial for Ebola. The trial was sponsored by the French health research body Inserm Envisage. Researchers wanted to test at least 120 patients, but drop in Ebola cases in Guinea has made that difficult.
We are starting to do some of these trials at the time when the number of cases has gone down quite a lot. So in fact, it's not as it would have been much easier earlier in the process when there were many more cases. Then you quickly get a sample size that enables you to assess what is the effect. So now, we're at the stage of the epidemic where there are relatively few cases. This is probably one of the factors.
Currently, thousands of doses of favipiravir are available compared to other experimental drugs for Ebola. And that's our Africa Health Report for today. Back to you, Vincent.
Well, Linord, thanks. And be sure to watch Linord Moudou's Health Reports every Tuesday and Thursday right here on Africa 54.